So in my time, it is about 4:02, so we'll go ahead and get started. Thank you to everyone who has joined us this afternoon for COVID Safety for Kids and Grandkids, presented by Pedal the Cause. I am Stacy Aveleys, the Director of Development here at Pedal the Cause. Thank you all for joining us today, those who are joining us via Zoom and those who are joining us on the web. We are also live on YouTube, and I believe we may also be streaming on Facebook. We will also be recording this panel today. So thank you to all who are watching us at a later point in time as well. We hope that you find this session helpful. And as always, if you have any questions about COVID safety or Pedal the Cause, feel free to reach out to us at info@pedalthecause.org, and we will be happy to relay any information to our panelists today. Speaking of our esteemed panelists, let's go ahead and welcome them before we get started this afternoon. Joining us today, we have two very esteemed panelists and friends of Pedal the Cause. Please join me in welcoming Dr. Abby Green, the Assistant Professor of Pediatrics in the Divisions of Hematology, Oncology, and Infectious Diseases at Washington University School of Medicine. Welcome, Dr. Green.
Thank you.
Thank you. Thanks for joining us today. We also have with us Dr. Josh Rubin, MD, PhD in the Department of Hematology and Oncology, as well as the Department of Neurosciences, Professor of Pediatrics at the Washington University School of Medicine. Hello, Dr. Rubin. Thanks for joining us. And again, I'm Stacy Aveleys with Pedal the Cause, and helping me with the panel today, who you don't see, but behind the screen is Emily Murphy, who is our Director of Marketing and Communications. So thank you to Emily for helping today. Again, if you have any questions as the panel goes, feel free to put those questions in the chat or send those to info@pedalthecause.org. We will try to intercept those questions throughout the way and catch them, as well as we will have some Q&A at the end of our time together. If we are unable to answer those questions, again, please send those to info@pedalthecause.org, and we will try to relay those to the doctors and get those answered after our session today. So this is an ever-changing topic, and we have a lot to discuss today, and we have some really great expertise available to us on the panel today and available to us in St. Louis. So before we get started, we know you're both very busy, so thank you for taking about an hour out of your day to spend it with us. We have a lot of people interested in this topic, as a number of parochial schools have gotten started with their back to school this week, and a lot of public schools in the St. Louis area and the metro region, as well as Metro East Illinois, are getting ready to send their kiddos back to school, either via Zoom or in person. So let's kind of dive in and talk a little bit about some Q&A as it relates to COVID safety for kids. We're going to cover some common questions as it relates to vaccinations, masks, general safety, and special considerations for cancer patients, both adults and pediatric patients. So let's just jump right in. I'll kind of leave this as a really open format, so whoever feels more comfortable answering the question, Dr. Green, Dr. Rubin, feel free to bounce answers off one another, feel free. And again, we'll also keep the chat box open, so I might jump in with some questions from our audience as it fits the topic. So let's start off with some general best practices. There are a lot of circumstances right now where we're going to encounter different levels of risk. Can you share some foundational best practices or guidelines that could help parents and or guardians when it comes to COVID safety for kids, when it comes to leaving the house and being out in public and or heading back to school?
Yeah, I think that's a great place to start. And Josh and I talked a bit about this, and I think I'll start by answering this question. So by way of a little bit more granular introduction, I'm a pediatrician, and I practice both infectious diseases and oncology, and I actually sort of practice at the intersection of those two fields. So I'm most interested in how infections affect children with cancer and those children undergoing bone marrow transplant. So that's sort of where I'm coming from. So I think a lot about COVID in this population. And in terms of best practices, I'm not sure that it's so different for children who are immune compromised or those who are healthy. But the two basic best practices are to keep a mask on and avoid people who are ill. That's tough for kids because there's a lot of kids with runny noses out there. But the masks are really important. Masks in schools are really important. I know that we have a diversity of recommendations in the local school districts. But masks are the thing that seem to mitigate risk the most. So, you know, when you're worried, keep a mask on your kids, especially indoors. Social distancing helps for sure. I think there's a lot of sort of show about cleanliness when it comes to prevention of COVID or mitigating risk. And I am a bit wary of that show. So we know that deep cleaning, while it's sort of common sense and we all want our spaces to be clean, doesn't help a whole lot when it comes to preventing COVID. You're not going to get COVID from a doorknob. And Clorox wipes, therefore, don't help a whole lot. So be a little bit wary of places that do, you know, advertise a whole lot of deep cleaning, but then don't require masks, because masks are the things that are really going to prevent COVID in kids and adults. So I would say that's sort of the best practices for all ages.
Josh, anything you want to add to that?
No, except I just want to make it clear that I'm a longtime friend of Pedal the Cause, and I'm a longtime pediatric oncologist, but I really don't have the specialty training that Dr. Green has about Green. I don't know why I said that. Dr. Green has about infectious disease in cancer patients, and in particular about COVID. So I'm going to happily listen to her answer specific questions about best practices with regard to COVID.
Absolutely. And that's completely fair. So one of the questions that's already popped up, and I'm sure a lot of people have questions about, is what if someone has already had a diagnosis of COVID? There's been a lot of discussion about lasting immunity in adults, but what about the question about lasting immunity in pediatric patients? So if a child has already had COVID, do they have lasting immunity? Is there any special consideration for a child who's already had a COVID diagnosis?
Yeah, that's a great question, and probably one that's best answered in two parts. One is for children with intact immune systems, and one is for those without.
Compromised, yeah, sure.
So let's take the intact immune systems first. The answer is becoming more clear, although, you know, as we've already mentioned, this is a rapidly evolving field with rapidly evolving data. So with any viral infection, you should get some immune response in a healthy person, and then you should not have such a significant illness the next time you encounter that infection. And so that's what we mean by immunity. You can have natural immunity, which comes from getting the infection, or you can have vaccine-induced immunity, which comes from getting immunized. So with COVID, we knew that in the beginning of this pandemic, most people who got sick with COVID didn't have a recurrent infection. There were some breakthrough cases with patients who had been previously infected, but it was rare. So it seemed that natural infection created substantial and protective lasting immunity. That is also true with vaccination, right? So we learned that when people started getting vaccinated last November and December, they had immunity to this infection, and therefore when they encountered the infection, they were less likely to either get infected or become ill. The first study comparing those two forms of immunity has just come out in publication form, and it looks actually like immunity is more durable or long lasting when it comes from vaccination rather than from natural infection. It's a little bit surprising because that's not usually the case. In other viral infections, we know that natural infection creates more durable immunity than vaccination-induced immune responses. We've learned a lot from COVID, and it's been a bit of an enigmatic disease, and so I'm not surprised to be surprised again. But I will say that's the data that I'm citing are early data, and I think it's also from adults because most children haven't been immunized at this point. So in adults, it seems, at least from early studies, that maybe the vaccine provides more lasting immunity than natural infection. I don't know if that will translate to children. I don't know if that will hold up in more sort of longitudinal studies, but but time will tell. So my advice at the moment is get immunized, even if you've already had COVID. If your child's eligible, get them immunized, because at least what we know right now is that immunization is really helpful in mitigating the effects of this infection. And to those of you who are putting questions in the chat, I'll keep an eye on it, and I can try to, if you have follow-up questions after I answer, I'm happy to try to circle back.
No, that's great, and a really appropriate transition, because our next section is actually about vaccinations. And, you know, because I think we are approaching back to school, and there is kind of this conversation for kids who are under 12, and what am I doing with my children? I have one child in the home who's vaccinated, I have one who's not. What do I do? There's a lot of questions. You know, from a medical perspective, what news or what's the latest that you can share with us about vaccinations for children? You know, and you know, you shared a little bit, but you know, what health advice do you have for parents and guardians, and what do we need to know? And what, you know, if anything, can you share about availability for vaccines for kids who are currently, you know, 11 and under, and anything about an expected time frame or immunity or expected response for children versus adults at this point in time?
Right. Okay. So current status of vaccine approval is that there is an emergency use approval, which is the FDA's sort of soft approval for vaccination of people who are 12 and older. There are ongoing clinical trials for patients who are under 12 years old, or people who are under 12 years old. So let's start with the over 12 group. My recommendation, my strong recommendation, is to get immunized, no matter, you know, what your immunologic status is. So I take care of children who have cancer in the hospital, and we're recommending vaccine for all eligible children with cancer. If you have a child with cancer who is interested in getting vaccinated and is over 12 years old, and you have any questions or concerns about it, talk to your provider, they can talk to me. I'm happy to answer questions directly. I think it's really important for everyone who's eligible to be immunized. The expected immune response in healthy children and adults seems to be equivalent between pediatric and adult age groups, at least the ones who have been studied. So kids respond just as well to immunization as adults, and maybe even better than the sort of elderly population. In people who are immunocompromised, the immune response is not as good. We have recently learned, like as recently as the last 10 days, that patients who are immunocompromised, who receive a third dose of vaccination, can reach the sort of immunity levels as immune competent patients who get 2 doses of vaccine. So the CDC and subsequently a lot of professional organizations that think about immune compromised patients have just recommended this week a third dose of vaccination for immune compromised patients. And that includes all eligible patients, so for children who are over 12. And we are starting to do that. That is now adopted as practice at St. Louis Children's. We're going to do that for oncology and stem cell transplant patients, as well as our other immunocompromised patients. And we can provide vaccination in or outpatient for those eligible kids. I think that's that. Oh, the updates on for under 12. Okay, so this is the less optimistic piece of news, because I do think that this vaccinations rolled out so quickly, and it's been so impressive, and they've been so effective, and the fact that the kids under 12 are moving slower makes me sad, both because those are the kids I take care of and those are the kids I have at home. But we're getting there. We are getting there. The trials have been enrolling for the last 6 months or so. The enrollment for the over 6-year-old group, so 6 to 12, is going to wrap up probably by the end of August. And then the FDA will want to see follow-up data for the next several months, probably more months than they wanted to see in adults. I think the adult studies required 2-month follow-up, and it will probably be twice that long or something in the child studies. So we're probably looking at another 4 to 5 months of data being gathered before the FDA will make a determination about use of this vaccine in children in the 6 to 12 year-old age range. The kids who are younger than 6 are a little bit behind that, probably a month behind that, although it's possible that the FDA will sort of wrap all of the data up together. And so I anticipate that we're looking at probably late winter or early spring before there's emergency use approval for vaccination in the under 12 population.
So are we going to get to a point that flu season and COVID season look the same moving forward? That we'll be going to the peds office for COVID shots like we're going for flu shots? Like, is that what we should be expecting?
Maybe. Some people that I respect very much think that that is very likely. Others who I respect very much think that this is a pandemic that will end. I don't know the answer. I think, I'll give it 50-50 right now. I think we're all probably looking forward to another season of vaccination. And we're learning right now. So the earliest folks got immunized in November and December of 2020. And we're learning right now from those people how durable vaccine immunity is. And I think as we see vaccine immunity start waning, we'll hear recommendations for the booster vaccination like we get with flu, or the seasonal vaccination that we get with flu. You asked a subtle question there, Stacy, that I'm going to answer, although I'm not sure you intended it, which is, does flu season and COVID season overlap? So we've learned a strange epidemiologic thing from this COVID pandemic, which is that we can actually suppress flu season. If we all wear masks and we all socially distance, not only do we mitigate the spread of COVID, we also mitigate the spread of influenza and all of the other respiratory viruses that impact us and our children in the winter months. But then we took our masks off, right, after the winter ended and after things started to get better. And all of the viruses came flooding forward. So you're probably hearing a lot of news right now about pediatric hospitals and pediatric ICUs being full. And I think it's important to clarify that yes, more children are getting infected with COVID right now, but they're probably not in the hospital and in the ICU entirely because of COVID. Kids aren't getting proportionately more sick with COVID or even with the Delta variant. They're getting sick because they're getting all of those other respiratory viruses that we conventionally think of as winter viruses because we pushed the winter season to now. And that was an amazing sort of unintentional experiment that we did. But RSV, for example, is respiratory syncytial virus, and it affects young children. It can be really severe in both immunocompromised kids and in very young children under a year of age. And those are the kids that are in the ICU right now. It's the kids who are getting RSV and who are getting influenza, who can't fight it because they don't have good immunity. So the neonates and the immunocompromised kids. And I think there's some co-infections with COVID and other respiratory viruses that are causing problems in these children. But I really think it's the shifting sort of season that's caused the children's hospitals and intensive care units to fill up. So a byproduct of COVID, but maybe not a direct product of COVID.
Yeah, I think that's really interesting. We're definitely seeing a lot of those as kids were outside in the summer. We're hearing everyone was sick this summer, and it's true.
Right.
Absolutely. So one of the follow-up questions with that, we have a couple of follow-up questions. One is about variants and the spread of the variants and the effectiveness in the vaccine. So I'm just going to go to that question. Is that if a child had COVID with little to no symptoms, would you expect that if they had a variant, would they expect a similar response?
That's a good question. I think that even people who had asymptomatic infections probably mounted reasonable immunity. I don't know of any specific data looking at that, but the pools of people who were studied to look at immune responses included both symptomatic and asymptomatic people who tested positive. So I think that if you got infected, if you tested positive, you mounted an immune response. Whether you got symptoms or not, I don't think that should should bear on whether you were able to or did mount an immune response. So people who had COVID previously are now getting infected again because of this Delta variant. I don't think that they're getting infected again with the Delta variant because they didn't mount an adequate immune response. I think the Delta variant just it's like a little twist, right, on the virus. And so the immune response sees it and can respond to it, whether that immune response came from natural infection or from the vaccine, but it might see it a little more slowly or a little less effectively. And so symptoms seem to be happening even in people who have immunity to sort of the original version of the virus.
Sure.
In the most simple terms, I want to be clear that the vaccine is effective in preventing both infection and severe disease of the Delta variant and of other variants. But it may be a little less effective than it was originally designed for. So I think that the answer to the question in the chat is yes. I think that a child who was previously infected with COVID, even if they had few symptoms, should mount an immune response and should not be at risk for severe illness if they contract a variant.
Okay, thank you. So, kind of mounting off that question, moving on to the variants and the spread is, for parents and guardians specifically, what do they need to know about the Delta variant and other variants that we might anticipate seeing and how they adapt to the rates of spread? And, you kind of spoke about the effectiveness of the vaccine, but is there anything that they should be doing differently to address that? And the answer is probably no, wear masks, social distance.
Yeah, I think that's right. I think that's the bones of it is we're back to wearing masks and social distancing, even if we are vaccinated, because we want to protect our community, right? People who are vaccinated are very unlikely to become significantly ill with COVID, even if they contract it, right? So you can still get the infection, you can still get sick, but you're not going to get as sick. And even if you're a pretty high risk person, it's very unlikely that if you're vaccinated, you're going to wind up in the hospital or severely ill with COVID. But you want to protect your community and you want to protect your kids and you want to protect the people in whom vaccination is not as effective, right? Like these immunocompromised patients. So now, even if you're vaccinated, we know that you can contract the infection and you can spread it, and you don't want to do that when it comes to kids. So that's why we're back to masks and back to social distancing. And
So
the Delta variant seems to be more effective at infecting people. It can more rapidly infect people. We will find another variant, undoubtedly, that will probably be even better than Delta, but it seems that this vaccine and the natural immunity that we got from the original COVID virus is going to hold up for the time being. So get vaccinated, but keep your community safe.
So to that end of keeping your community safe, we're moving back inside into the classroom, and the pods that we had over the summer are becoming more communal because we're not with our neighborhood crew and our close family and friends. We've moved back into the classrooms and we're interacting with families that we may not know as well, classmates that we may not know as well, people who have not disclosed whether or not they are vaccinated or not. So what should parents and caregivers consider with masking and interacting with those who they may not know their vaccination status when it comes to school, sports, play dates, and going back to those colder months that we experienced last winter, and maybe just a refresher on what parents and caregivers should consider moving from those comfortable outside, outdoor, safer feeling months back inside.
Yeah, I think this is such a hard question, and we've got, we're 18 months in now to this pandemic, and we're all sorting out how to live our lives in the midst of a pandemic and be safe, and making those decisions for our kids. And I think a little bit of this is sort of personal comfort. Being indoors without a mask is the highest risk situation. So if you want to be as careful as possible and you have a child who's ineligible for vaccination, keep a mask on them and keep them out of indoor crowded areas as much as possible. Kids need to live their lives, right? And so for sports and group activities, wear a mask, trust your community as much as you can. Encourage your community to also be vaccinated and be masking, but certainly there are question marks even in your community and in your child's community. And your willingness to absorb that risk depends a little bit on you, and on your child's status too. I know I'm talking to a lot of people who have interacted with or have children who've had cancer or have cancer, and that's a high risk population. And I imagine these families of children with cancer are not as willing to absorb that risk of infection, which I completely understand. So there's a balance, and I'm really sympathetic to the balance of living your life and living your life safely. And I think that's an individual decision, but certainly the safest thing is to avoid indoors unmasked with other people.
So we have a mom who's asking a question. She's asking, is her child safe if he wears a mask, but no one else in his school is wearing a mask? There are certainly school districts that are not mandating masks, and maybe this child goes to one of those school districts, making an assumption, don't know. He's 11 and is not vaccinated. So there's certainly within the state of Missouri or Illinois districts that are not mandating masks, and maybe this family is one that chooses to wear a mask. So this boy will be wearing a mask and maybe his peers will not. So, mom's asking about his safety within an environment where peers will not be wearing a mask. So could you speak to that, please?
Yeah. So first of all, kudos to any family who chooses to wear a mask.
Absolutely.
And it's tough in this age group too. I think social pressures are difficult in an 11-year-old and kids around that age range who are not quite eligible for vaccine, or even those who are, but are choosing to wear a mask at school. And I wholeheartedly support that decision. Is your child as safe? So we'll do the comparisons. No masks for two people face to face, no masks is the least safe. If one person is wearing a mask, that's sort of the middle ground. If both people are wearing a mask, that's the best scenario. That's the safest scenario. So you can't do anything about the other kids in the school. You can't change those parents' minds or that school district's decision, but you can provide safety to your child by putting them in a mask. So no, not as safe, but yes, some degree of safety above not wearing a mask at all. Can I go to the next one, Stacy?
Yeah, absolutely.
Do you want to?
Yeah. So are you seeing what I'm seeing the question about?
Yeah, that's just a good follow-up question.
Yeah, absolutely. It's a great question. So just for the audience, if you can't see the questions that we can, what are your thoughts on kids wearing masks for indoor and outdoor sports this fall and winter? Great question. I have two boys, both of whom play sports, so I probably would have asked this question if no one else did. So thank you for asking this question. Very interested in the answer.
Yeah, so for my patients and my own children, I also struggle with this one. I think that indoor, it's important. And that's sort of the advice I give to my patients and the decision I make for my own children, that indoor sports, even during the summer, my son was in a sports camp indoors and he wore a mask indoors. Outdoor sports is a little bit personal decision. So back in the fall, before there were any vaccines, there was a lot of discussion in school sports around, what's a high risk sport, what's a contact sport, what's a low risk sport. Maybe we overthought it, but I think, those sports that have more face-to-face contact, even if outdoors, the safest thing to do is to put a mask on. If your kid's playing tackle football, it's probably safest to put a mask on. For sports like soccer, where there's probably less, or tennis, for example, where there's less sort of personal space violated, it's probably safer not to wear a mask when you're outdoors. So I know that's a bit of a nebulous answer, but really there's a spectrum of risk and of safety, and the most conservative thing to do is to put a mask on all the time. I personally don't think that's necessary, but you sort of have to weigh the risk of the activity that your child is going through.
Thank you. So I think this is kind of a hot topic, what we're moving into. We've been talking about like the literal and physical health of our kids, but one of the things that I think as parents, we've really noticed is sometimes a change in our kids' behavior and some loneliness and just some changes in our children as a result of this pandemic. So let's talk a little bit about pediatric mental health. We certainly speak about this. It's a very hot topic among adults, but let's talk about it amongst our kiddos. Certainly important at this time. And it's definitely had an impact on kids, regardless of their age. So if you have any thoughts for parents and caregivers about ways in which they can support their kids during this time and their mental well-being, as well as their physical well-being, I think everyone would appreciate you sharing that at this time.
Maybe I'll talk. Abby, it was fantastic listening to you, though. What a wealth of information, and so clearly presented in contrast to what frequently is the case. So as pediatric oncologists, we're always concerned about the mental health of our patients and their families. I think for any of the families on here who have children who've been treated or are being treated for cancer, full well about the sort of assault on family well-being of having a child with a cancer diagnosis. Not only is there a child severely ill, scared themselves, parents scared, siblings scared, that child is also frequently isolated from normal social interactions. Even before COVID, there was a social isolation, not being in school all the time, not being able to participate in things freely with friends. There's an impact on siblings because so much attention in the family is focused on the child with the illness. And obviously for parents, there's an enormous stress of caring for a child who has cancer. I think everything has been exacerbated by COVID for all children with severe diagnoses like cancer or chronic diagnoses of any kind. Because in the past, the ways that we tried to normalize lives was about trying to get kids back into school and trying to make it possible for kids to interact with their friends and be out in the world, and that's not been possible. It is on the, maybe an unexpected positive, the fact that everybody else is suffering that social isolation makes it a little bit more normal than it was for kids prior to COVID, and that might be a good thing. Because they can share in that experience. But I think in addition, we all live with this constant stress of all of the anger and tension and blaming and public display of just what approaches hatred at times over the differences in our opinions. I think that is unnerving for everybody, regardless of what side you are on. And obviously, there are so many other global things in the news now that are all threatening. And as a consequence, mental health issues are now becoming a second pandemic worldwide. And if we take general principles of dealing with chronic and acute mental health issues, and we bring them to bear on our children and our families, they start first with recognizing that they're there, accepting that they're there. I think thinking about them the same way that you would think about any illness, common cold. You know why you're stuffed up and why you're coughing or sneezing and why you feel bad, but you still do things to make yourself feel better while you're suffering. It's not a chronic condition. It's an acute condition. And I think most of our patients and families suffer from from acute mental health issues, but they require attention, which means in this case that you be thinking about your children, all of them, your child with a cancer diagnosis and their siblings, looking for those signs of primarily withdrawal, not being interested in activities, either with friends or with family, or sitting down to dinner or playing games or doing whatever they do. Looking for signs of a change in behavior, particularly aggressive behaviors or angry behaviors. Looking for a decline in the ability to pay attention or perform in school. And if you see those things, to talk about them. Kids don't always want to talk about them, but it's still important for them to know that you're noticing. I think one of the hard things for a child is when they're suffering with anxiety and fear, to feel like they can't bring it up because it doesn't seem to concern you as a parent. So I think noticing, bringing it up, not necessarily expecting that they'll talk about it, but at least you're communicating your awareness of the issue being there. And obviously, if they want to talk about it, it's great if you can talk about it. But we also have tremendous mental health services available everywhere. And all you need to do is talk to anybody in our clinical programs to access a number of mental health professionals to help you. I think the same is true for the siblings of your children who are oncology patients. In the support groups that we run, they are a group that really feel like their needs are frequently being overlooked, even in the absence of a pandemic. But they suffer the same fears and anxieties that we all do about the pandemic and about the world. And it's exacerbated again by a cancer diagnosis. And finally, I think it's really important to be mindful of how you as parents and caregivers are handling all of these stressors. It's clear from adult populations that don't have children with cancer that the pressures and the events that are happening daily now are resulting in significant increases in depression, anxiety, feelings of isolation, feelings of hopelessness. If you're suffering from those things yourselves, it makes it very difficult to adequately care for somebody else. And I think all of these things have always been issues for us as oncologists, but I think that they are actually much more common and more severe now in the setting of COVID. Abby, do you have anything you want to add?
No, that was beautiful. Thank you.
You're welcome.
Thank you. I think it's unfortunately very real for a lot of students these days. And I think the schools have become innately aware. And as you've mentioned, clinicians are innately aware, but I think the schools have also built up a lot of resources. So I would encourage parents and guardians to also reach out to your medical team, but also reach out to your schools as well, because your child and your student spends a lot of time in the classroom. So the classroom teacher may be aware of some behaviors that you may not see at home. And they may have some resources available to you as well in the district. So that's another resource available to you.
And if I could add one thing that I meant to include, it's very concerning to me based on my experience in the way that our patients are frequently bullied, which is always remarkable to me. It's concerning to me, like the parent who asked about their son going to school with a mask while other people were not wearing masks. And I think both you, Stacy, and you, Abby, brought up the idea that peer pressure. I think, as always, it's important to be thinking about what bullying does to a child's sense of well-being. It's very damaging, as we all know. And I think this is just another potential vulnerability risk for bullying in any child that chooses to wear a mask in a school district where others are not wearing masks, but particularly for a child who already is vulnerable because of a cancer diagnosis.
So to that end, Dr. Rubin, are there any other considerations during this time that patients and guardians should be aware of as they're considering sending a patient back to school, during a global pandemic with a cancer diagnosis?
Obviously,
I mean, there's a litany, but what else, unfortunately, do we need for them to
personally,
consider?
from, all the years of pediatric oncology and from my own experiences as a parent, I think discussion beforehand, checking in during, always being available is the best defense. It's like wearing a mask. You do best, I think, to prepare, to acknowledge for your kids that these things are hard and they're stressful, and that there may be times when they feel anxious, because I think anxiety is really the way that anxiety and acting out are the ways that these things manifest most commonly. Withdrawal would probably come right after as third. And to just open the door for preparing for it, finding out what kind of things might be helpful. I've always found it useful to listen and then ask, what would help you right now? What could I do to make you feel better right now? Because that's never the same for two people. And even if the answer is nothing, at least, again, your child knows that you're ready to listen, and you're ready to not only listen to them describe the problem, but listen to them tell you what they think they need. And I think that goes a very, very long way. And it's an ongoing thing. I think it's something that needs to be checked, just like a CBC.
Some really great points. So let's talk on a little bit of a happier note. One of the first groups that we were really concerned about getting vaccinated were people over 70. And so, we have multi-generational families. And one of the questions that came in towards the beginning that I kind of held off on because we were really focused on schools was a question from a grandparent about vaccinated grandparents. So we had a question about a vaccinated grandparent interacting with their grandchild. So what do they do now? Now that the grandparents are vaccinated and they want to spend time with a young grandchild who is not vaccinated, what should they be concerned about? Again, opportunities to engage outside in the summer months. As we are getting into the cooler months, starting to move inside, maybe some conversation about safety and conversations about warm weather months, moving to the inside weather months, how to safely engage with family, and just maybe some interactions for multi-generational families. If you guys could both touch on that, that would be great.
All right, Josh, am I up again?
Yes.
Okay. I love this question.
You've been tagged.
No, this is a happier question, Stacey, because I think we have some optimism this sort of holiday season compared to last. Last holiday
That's
season.
Good. We need some optimism.
Yeah, I mean, I think I still dread the Thanksgiving travel days because it sounds horrible, even in the slightly muted pandemic that we're in now. But I do think that families can take advantage of holiday time together, or just time together, period, in a more safe and controlled way with, vaccination being available. So let's think about the risk to each party, right? We have a grandparent who's vaccinated, but at higher risk of severe complications of COVID, and then a grandchild who's unvaccinated. So the risk to the grandparent, I still worry a little bit about. A vaccinated grandparent, as I said, is unlikely to end up in the hospital or in the ICU or having severe complications of COVID, though could still contract COVID from that child, right? If the grandparent is not a particularly high risk grandparent, so not a lot of underlying illnesses, or the sort of comorbidities that we hear about being problematic with COVID, I think that it's totally reasonable that that grandparent and grandchild are together unmasked indoors, as long as the child is asymptomatic and the grandparent is not high risk. When we get into grandparents that have more comorbidities or more risks, this is again a bit of a personal decision, but I think that it's prudent to think about wearing a mask when you're indoors with an unvaccinated grandchild to protect the grandparent. So then we move to the grandchild. So what's the risk to the grandchild who's unvaccinated? Of course, the risk is that the grandparent would infect that grandchild, which is possible even in a vaccinated grandparent. It's unlikely that you're going to transmit COVID if asymptomatic to a grandchild if you're a vaccinated grandparent with no symptoms. There probably isn't going to be a whole lot of asymptomatic transmission. But if you have symptoms, if you're a vaccinated grandparent and you have a runny nose, or if you have a cough, or if you have a fever, just don't go near that grandchild. I think that's the best way to mitigate risk. But I do think we're in a lower risk sort of playing field now, and it's safer for families who, of course, know each other's vaccination status to be together.
Good. We like to hear that. So we talked a little bit about previously about just, when we were unmasked and germs going around and people getting sicker. Let's talk about cold and flu season, and let's talk about kids being back in school and germs and runny noses and headaches and sore throats when we're back in school. How quickly are we isolating? Are we testing for COVID? How are we addressing cold and flu season this year? What are we doing?
Yeah, I mean, we're already there. Everybody's got colds and flus right now. And so I think we're facing this right now, and we may be facing it well into the winter. And I think the answer is be quick to respond to symptoms in your child. A little bit of clear runny nose is probably not COVID. But if your child has a cough or a fever, or has, a more substantial illness, that is something that you need to address right away. So keep them away from other people. And we're in a different position again now than we were a year ago. We didn't have testing a year ago. We were limited in so many ways. And now that's not the case. We have tests available. We have 15-minute, very accurate molecular tests available in your pediatrician's office. Not every pediatrician, but many of them have made this available. And so be quick to get your kid tested. And it not only gives you a sense of how to protect your child and your child's community, but also could get your kid back to school more quickly, in a safe way. Now I'll say the ICUs, the pediatric hospitals and ICUs aren't filling up because of COVID alone, right? They're filling up because of these other respiratory viruses. So we have an opportunity now to be mindful of those viruses in a way that I don't think we have in the past, right? Masks will prevent flu season. If your kid has symptoms of, flu or a flu-like illness, keep a mask on that kid or keep them out of the classroom while they're still symptomatic to prevent the spread of something that's even non-COVID. I think we all need to be so mindful of our neighbors and our community right now in a way that we haven't in the past. And this is really an opportunity. And while it's tough to keep a kid home from school, and I struggle with this myself, I think while symptomatic, even if it's not COVID, it's a good thing to do.
Absolutely. Well, I believe that was our last note that came through. I'm just going to go through chat to see if there was any other questions, but we are rounding out on our hour. That was a really great discussion. I think we got through a lot of great information today. As a parent of my own 2 children, I found it very helpful, and I have a lot to consider as I have one vaccinated child and one who is not eligible to be vaccinated. A lot to consider. So I'm sure everyone else has a lot to consider as they're trying to figure out what's right for their own family. So there are no new questions in the box. So I'll give it just one more minute. If anyone has any questions, now's your opportunity to get in those last questions.
I see one more, Stacy. It's a follow-up on the grandparent question.
You do? Maybe, is it just to you? Because I don't see it in the group chat.
It's in the Q&A. I can read it.
Please. Look at you. So multifaceted.
I've learned a lot about Zoom in the last year and a half. I'm pretty good at
I'm
it.
so impressed. I don't even see it. Giving me a run for my money, please.
Okay, so this is a follow-up on the grandparents and grandchildren interacting with one another. And the question is about grandparents with some extra risk factors and whether masks should be used for both the grandparents and the grandchildren or just the grandparents. And so the answer simply is that the most safe thing to do is put masks on both people. And that was a study that was done early on at Duke. It was called the Duke Mask Study. Two unmasked people are the most likely to transmit virus to one another. One person in a pair with a mask is, conveys some safety, but two people with a mask is going to be the safest measure here. I will say, it is hard as a child to transmit COVID if you're asymptomatic. So that's a consideration for families. If you have an asymptomatic child, it's unlikely that child is going to transmit COVID. The caveat to that is that this is an ever-changing field, and when we didn't know about Delta, and we thought that adults weren't that good at transmitting when asymptomatic, and Delta proved us wrong on that. So that's the status right now. But the stock answer is that masks on both parties is going to be the safest thing. And then I see another question.
I see it too. From our executive director. So David's asking if you feel that the numbers of reported cases of COVID in pediatric patients is underreported. Do you feel that that's true? Do you feel that there's more pediatric COVID patients who have been diagnosed and have been reported?
I don't think so in a more substantial way than in adults. I think that we probably are universally underreported because we're undertested, because there are so many asymptomatic people with this infection. Maybe there are more asymptomatic children than adults. And so maybe in that sense, they're undertested and therefore underreported. But I don't think that there's any gaps in reporting from, for example, pediatric practices or children's hospitals to the agencies that are gathering these data. I hope that answers the question.
No open questions and nothing in the chat. So I think we'll go ahead and then close. So in conclusion, I really want to thank, it looks about 30 participants joining us today, as well as our really esteemed panel and wonderful friends of Pedal the Cause, Dr. Abby Green and Dr. Josh Rubin from the Washington University School of Medicine, their respective departments. Just want to thank them both for their expertise, their passion, their commitment, and they're just really good people, and everyone can clearly see that by spending just even this hour of time with them. They're just wonderful, wonderful individuals and very talented clinicians and great people, and are clearly doing the best for this community to keep us all safe and healthy. And we just want to thank them both. From Pedal the Cause, we thank you for being with us today. Just a reminder that registration for Pedal the Cause 2021 is open. Our Kids Challenge and Ride for a Child program parade are open. Kiddos ages 3 to 12 are eligible to participate in a car parade, which is the most COVID safe way to participate on Saturday, September 11th. So registration is open today. Pedal the Cause weekend, September 25th and 26th is also open on our website at pedalthecause.org with several COVID safe precautions, new courses, and everything available for a safe and memorable weekend to raise awareness and critical funds to create a world without cancer. We want to thank you all for joining us today, and visit pedalthecause.org for the latest information about our 2021 event and for our full event calendar. Again, thank you all for joining us. Thank you, Dr. Abby Green. Thank you, Dr. Joshua Rubin. Thank you all for joining us. I'm Stacey Abelies. Thank you again to Emily for all of her help behind the scenes. Thank you all for being with us. This will be available online if you'd like to watch it over and over again. A lot of great information. If anyone has any follow-up questions, please email any questions to info@pedalthecause.org, and we will be sure to get it to the doctors, and they will be happy to follow up, and we will facilitate getting any of those answers for you. Please be safe. Please wear a mask. Please social distance and make smart decisions. And when you're out on your bike, wear a helmet. Thank you so much. Have a great day. Take care.
Thank you. Bye.
I have to end with something cycle related.
Yes.
Wear a helmet. Okay. Take care, everyone. Bye-bye.
Bye.
Bye.
Bye. Thank you so much.